Good afternoon, everybody, and welcome to the Ministry of Science and Innovation. For those of you who don't know me, I'm Veronica Jacobson, Manager of Strategy here at the Ministry, and it's my enormous pleasure today to welcome David Albury to come and talk to us. It's a great privilege to have him here. He's here for just 2 days. We'll be talking to the SSC on a very similar topic tomorrow. David has a long history in thinking about innovation systems, and in particular about innovation in the public sector. He's visiting Professor of Innovation Studies at King's College London. He was previously with the Prime Minister's Strategy Unit, where he led a lot of reviews, and in particular on innovation in the public sector. He's currently working and consulting widely on innovation systems and innovation, particularly in the public sector, and leading change in that area. So it's our great privilege today to hear from David, and I'd like you all to welcome him.
Thank you very much, Veronica. I'm going to talk for, I don't know, about half an hour. But if there are sort of things that you don't understand that I'm saying along the way, or things that you'd like me to stop and dwell on a bit more, then do interrupt, and then we'll have time, I think, at the end for some questions and answers. And the title today, I was asked to talk about systems of innovation. I'm going to be talking mainly about public sector innovation, though I believe a lot of what I have to say is as applicable in the private sector. Indeed, it leans on quite a lot of experience in the private and third sector as well as in the public sector. And I was very struck as I was thinking about what I might say today to take the theme, in a sense, around connection, to use this notion of connection to just really put forward 3 messages or 3 provocations or 3 statements that I think are important guiding statements about how to actually foster and stimulate innovation in public services and in the public sector. And it's interesting to me that some 8 years ago now, when Jeff Mulden and I wrote the paper for the Prime Minister's Strategy Unit in the UK on innovation in the public sector, Veronica was kind enough to call it a review. Actually, it was a rather strange review, because most of the reviews that we did, you had to wade through volumes of literature and research reports and so forth. Actually, at the time that we wrote it, there was practically nothing written about innovation in the public sector. Indeed, as is, I believe, the case here, most ministries of innovation, or ministries of science and innovation, paid little attention to public sector innovation. They focused almost exclusively on private sector and business innovation. It's over the last 8 years, most developed economies have started to look at the issue of public sector innovation, not least because of the fiscal constraints, the financial constraints that there are on it. So, I just want to take three messages on the theme of connection. And these are the 3 messages that I thought would talk about: connecting innovators together and with potential adopters. I'll talk a little as well about connecting with users, and particularly with user networks and organisations. And then thirdly, I want to say a bit about what I've called here practice-based policy making, and connecting the ministry, connecting government departments with the people who actually deliver and provide services. So these are the 3 messages, and with each one, what I want to do is to take a sort of case study, a sort of programme, an initiative that's happened somewhere in the world that illustrates or exemplifies this point, and try and draw out of that there. So these are the 3. We'll proceed through and see how we go on that. Okay. So the first one about forging communities of practice, connecting innovators together and with potential adopters. And the example I want to take is to take the innovation zone, the I zone in New York City, I've had the privilege of working with over the last 2 years. This is an attempt to create a wide-scale, transformative innovation across the New York public school system. And I'm going to give a little bit of background to that. New York, for approximately 50 years, the graph doesn't go back that far, but for approximately 50 years, the graduation rate of New York City's public schools stayed at about 50%. That is, 50% of students in the New York public school system failed to graduate within their allotted time. Flat line, 50 years. And then in the 2000, and he subsequently appointed a man called Joel Klein as the Chancellor of Education, and they put in place various education reforms. I'm not going to dwell on the early phases of that, but the effect of those education reforms, actually quite similar to some of the work we've done in New Zealand, some of the work in Australia, in the UK and elsewhere, not very dissimilar, increased graduation rates from 50% to somewhere around 67, 68% in a period of 7 or 8 years. In fact, New York City was the fastest improving urban school district in the world for that period. A tremendous achievement. So by 2009, 2/3 of students in New York City were graduating within the allotted time, or to push it the other way around, it was still failing 1/3 of the students in New York City. And actually these figures disguise something else, which is that although those students were passing end of school tests, the majority of those students were not completing their college graduation. So they weren't, in the words they use in the US, college or career ready. They passed the tests, but actually their skills weren't sufficient, their qualifications, their knowledge wasn't sufficient to take them on to the next stage. So, and I borrowed these aren't my slides, they're New York City slides. So they came to a conclusion.
Yeah. I'll just ask a question about the previous slide. My first question is does that represent most of the New York schools or all? And
that's an aggregate of New York City public schools.
It's just like frankly mind-boggling that 50% are failing. What's the sort of variation across different schools in pass rates?
Well, the biggest variation, which I should have said something about, so thank you, is the biggest variation is a class and racial segregated inequalities. So if you look at African American and Hispanic students, you see that their rates are even lower than this. And if you look at Hispanic students, they're even lower than this. And in fact, although you've got this increase, we don't find any real reduction in those inequalities over time. So, of course, as with all systems, actually you have one of the best education systems in the world in New Zealand. They may not feel like that to you, I don't know, but it's, you do. But it's not, in New York, they're not a high-performing education system, as these figures demonstrate. Yeah, oh, I'm not going to get anywhere.
In 2000,
yeah.
were those 50% college ready?
No. So the college graduation rates, you want really frightening figures, the college graduation rates of students from New York City was about 12 or 13%. 1 in 8 students who went through the New York public school system graduated college within the allotted time. States have lots of remediation processes, so people would stay on for years and years and years and do better over that, but effectively that was the position.
One more question.
Yeah.
The Economist had an article just a couple of weeks ago about grade creep in the United States. So this increase isn't partially due to lowering the standards, is it?
No, I mean, actually it's quite good. We're missing one of the lines here. There's 3 different measures being used here of different ways. I mean, it's a genuine increase. Even if one looks at it, if you took all the other sort of urban school districts in the States, New York is accelerating much faster. So even if it's 2 or 3% out, the improvement is quite dramatic. But in a sense, what's important here is that the belief then, the claim was, as I say, to the New York City slide by the Chancellor and by some of the principals in New York and so forth, was the belief that it wasn't going to be enough, therefore, just to improve what they call the 150-year-old classroom model of education. They started to say, what sorts of educational processes, models and practices do we need to put in place or need to be developed that will both increase the attainment rate at end of school exams, would deal with the inequalities, the class and ethnic inequalities, and make kids college and career ready. So their view was, very schematically, if we carry on with the 150-year-old classroom model and keep trying to improve it a bit, we'll get somewhere further up. But if we really want to get to college and career readiness, if we want kids who are really going to be equipped for the 21st century, for the sorts of knowledge economy and global economy that they're going to be facing, remember this is in one of the world's great cities, then we're going to have to find a new or different type of approach to this, a different way, a fundamentally different way of educating the children of New York City. And so after a lot of research and development and horizon scanning around the world, they came up with a vision of, a vision of what this this model might be. And it's evolved a bit over time. And if you think about the traditional classroom-centred model, as they talked about it, with a standardised curriculum with limited differentiation, test-centric standards measuring students on the test, we don't need to know all the details of this, generic teacher role not aligned to particular teacher talents or particular student needs, and they were looking at a move towards what they called a personalised mastery model or a student-centric model, they had all sorts of different words, that had, this is the sum total of their vision, had a notion about personalised learning, anytime, anywhere learning, about being able to learn in different ways, about new staff and student roles, about performance-based assessments. The details don't matter in this point. For those of you that are interested, happy to talk afterwards and so on. The important thing was this created a vision of a different sort of education system. But rather than thinking, we, the Department of Education, are going to decide what the detail of this is, or what the models and detailed practices of this are, or what assessments would look like, or what the curriculum would look like, or what schools would look like, or indeed what classrooms would look like. What we wanted to do was to enable the schools of New York City, or a group of the schools in New York City, to develop those models and practices for themselves. So that having articulated a vision of it, what they wanted to do was to put in place the support conditions which would enable the schools themselves to develop the new educational practices. And so what's come to be called the New York City I-Zone was born. Now, the important part of this was it was not schools individually. There are loads of examples around the world of innovation funds or innovation programs or innovation initiatives that are about giving out grants to individual hospitals or schools or prisons or local authorities or whatever it may be to carry out some form of innovation. And generally it is just about giving out money to it. In New York City, the notion of the innovation zone was a notion of bringing together those schools who were up for, ambitious for, committed to these changes, to work together in a collaborative fashion to enable them to collaboratively problem solve the problems of introducing new forms of education and new forms of teaching and learning and so forth. So that within the innovation zone, not only do you have, as it were, the individual schools developing their own models, but schools collectively doing this and supported by a range of partners. I'm not going to do that bit. So this is a schematic diagram of what the Innovation Zone in New York City is about. I think it has important lessons for us. Probably the most ambitious, aspirational and well thought through strategy for transformative innovation of public services, I'd argue, anywhere in the world. It consists of, as I've talked about, a community of practice of a group of schools. Currently, it started off with 25 schools last year, it's brought on another 25 schools this year, so there's 50 schools out of the 1,600 schools in New York, working together to develop these new models of education and of teaching and learning. They are supported by a range of partners and resources. So the Department of Education, it's not itself doing this, it is brokering in the different expertises, knowledges, research and skills to support the schools in developing their new models. So the I-Zone is about incubating, prototyping a proof of concept, this community of practice that's there. But it's also about reaching out to the rest of the system. It's not doing this just in isolation, but a really important part of public sector innovation is also about, that we know, is that if we want, as in the private sector, if we want those innovations to spread, then one of the key parts of this is to involve the organisations that are potentially adopting organisations in the innovation process itself. They're not so intensively supported, but they are engaged in that process of innovation. So if you go back to my overall message about this part of the talk, it's about not just forging links, connecting together the individual innovating organisations or innovators, but also connecting them with the potential adopters.
Did this evolve to this, or this was the thinking before it kicked off?
No, if I go back, so when, this is where they got to in the beginning, and then they went through an intensive process with myself and many others of thinking, okay, how do we get from here to here? And it had many false starts. I'm really surprised you know, that actually in the first year of its implementation, lots of things didn't go right, so it's absolutely an evolving process. But this was so where it gets to on this is somewhere it evolved to. It took about a year, 18 months to develop just this schematic outline. With, as I say, this notion about getting potential adopters involved, and also critically, which we may want to come back to later on, is the department seeing its role, or the ministry seeing its role, as creating the system conditions that will incentivise these innovations to spread. And the reason why I'm going to mention this in each of the parts of this presentation is that in virtually every city and country in the world, you can find examples of really excellent innovative practice in different schools, in different hospitals, in different primary care settings, in different prisons and so forth. And one of the privileges of the sort of work that I'll do is if you go back, or invited back 3 or 4 or 5 years later, you'll often find those innovative practices still just locked in their original location, still in that individual school. Everyone can point to exemplars, but actually the problem of public sector innovation is the problem about getting spread or diffusion or adoption on a wider scale. So this I-Zone 360, as it came to be called, was also about thinking about the system conditions that were necessary, the policy frameworks, the funding frameworks, the accountability frameworks, that would mean that organisations were incentivised to adopt the innovations that occurred in, if you like, in small places in different parts of the system. which is why I say that this is probably one of the most comprehensive and robust strategies that there is in the world, and in terms of ambition. This is 1,600 schools. It's getting hundreds of thousands of students and trying to fundamentally change what was the 150-year-old classroom model into a model more fitted for the 21st century. Okay. And as I say, I'll pick up the theme of diffusion again. So, lesson, message one, forge communities of practice and engage, so don't treat them as individuals, bring together the innovators and connect them with the potential adopters. Message two, connect with users, user networks and organisations. And this theme about connection with users is, of course, now sort of orthodoxy about public services in a way that it perhaps wasn't 10 years ago, but I want to give it a slight spin as I talk about this. So the example I want to give here is some of the work that's been going on in the National Health Service in England. It started with a report by Professor Lord Aradazi, who is an eminent surgeon, but also happened to be at the time a government minister. And he led a major review of the National Health Service. The National Health Service in the UK has 1.25 million employees and a budget of £120 billion a year. It's a large organisation. And it is faced with a whole set of pressures and constraints which are common across the public sector, but particularly intense in health, as you are probably aware. That is that health budgets are constrained, but health demands are increasing. The inflation costs within health are very large for drugs, technology, and all sorts of reasons, but driving demand pressure in health is that as we have an ageing population, so we have increased complexity, increased comorbidity of disease, we have patients who have access to more information, we have the possibility of technologies, and in a massively constrained financial environment, so that in the National Health Service in the UK has to save, out of that 120 billion, has to save, as it were, 20 billion over the next 4 years, 20 billion. So this is, again, this is not like, oh, we'll just have a little bit of innovation here and there. We've got to think sort of rather fundamentally about how we approach it. Yeah.
It's a slightly tangential question, but is the National Health Service, or the health system in the UK, is it predominantly a government provider, or?
Yeah, overwhelmingly. I mean, it's government funded, so it's a publicly funded system. It's funded out of general taxation. It's free at the point of delivery, with a few little exceptions around the edge. And the vast majority of it, about 96% of it, is provided by public providers. There are a few slightly increased private provision, but it's still actually full talk, very simple. So, when this review was carried out in 2009-ish, one of the themes that it took in this review, this next stage review of the NHS, this fundamental review of the NHS, was to say, how do we promote really radical innovation across this vast organisation? And I don't want to talk a lot about the Regional Innovation Fund, but this was part of it. The NHS in Britain at that time was divided into 10 regions, or in England, and the idea was to have a fund within each region that would do some of the sorts of things that I was talking about in relation to New York City, but would really be about trying to think through how the health service could meet these demands and pressures over the next 5 or 10 years. We can come back to the actual fund itself. One bit of it in London, in the Regional Innovation Fund in London, took as its focus something that we labelled after the light bulb. The reason for this is just a sort of anecdotal thing. Lots of people, when they think about innovation, think it's all about creativity. The Health Service Journal, which is the major health service journal in the UK, illustrates any feature it has about innovation. It just sticks a picture of a light bulb there as though innovation is about the light bulb moment. In fact, we know how to create those light bulb moments. That's not very difficult. There's lots of processes for creativity, for thinking outside the box, for all those sorts of things. You can take virtually any group and use these processes and get lots of ideas. The hard work of innovation isn't about creating those ideas. It's an important part of it. The hard work of innovation is about incubating and prototyping and testing and creating proof of concept in those. All those things which are after the light bulb moment are the really critical parts of this. So after the light bulb was a way of beginning to think about how could we really not just have lots and lots of good ideas, but some really profound and radical innovation that would diffuse and go to scale. 3 or 4 different stages in this programme. We looked at, and I'll say some more about this early stage under my third heading, but we looked at not just what happens in health, but why do you have differing rates of diffusion of innovation in different sectors? Go back to my point about what innovation is, how things tend to stay in little pockets. Yeah. The rate of diffusion of innovation in the public sector is very low in most countries. Public sector generally, particularly true in health. It's not that the public sector is less innovative, it's just as innovative on any measure you want to take. It's just as innovative as the private sector. The difference is in the rate of diffusion, the rate at which those innovations spread and are adopted by other organisations. So we looked at we tried to understand other sectors, other countries, other systems, and what made the difference in terms of diffusion. And in this project, in this programme, we also took people who were from radically different perspectives. They weren't all those people who always, in this case, thinking about health. They were people, we had anthropologists, we had people who were social campaigners, we had people from industry, we had different academic disciplines in play to try and bring in some breakthrough thinking around the characteristics of a health system that would enable faster rates of diffusion. And we took the insights from that, constructed a different health system artificially, and used a simulation to test out whether that actually changed the rate of diffusion. And it came up with a set of recommendations, which is sort of all a long preamble to this point. And I only want to focus on 2 here. Again, happy to come back on any of these others, 8 or 9 of them. And I mentioned in a moment, but the 2 I want to focus on is about building alliances across internal and external networks and engaging and mobilising, in this case, patients and carers. Remember, this was in health, but cross out patients, put in users, and you're in the right place on public sector innovation. Let me just dwell here. Most of the thinking that goes on in the public sector believes that diffusion or spread of innovation takes place sort of through 2 sorts of mechanisms. It sort of assumes, the implicit assumption is, firstly, that it's about information. Most ministries and departments around the world believe or operate as if public sector innovations in health or education, will spread through us producing pamphlets and websites and exhibitions. Virtually everywhere I go internationally, this is what people do. The research evidence is overwhelmingly that these are of enormously limited effectiveness. Because actually it's not, radical innovation is not just an informational problem. It's not just about having information about innovation. It's not just being told many, many times how wonderful something is. Because nearly all radical innovations involve some changes in working practices and changes in behaviour. And people don't change their working practices and behaviour just on the basis of a piece of information they receive. So all these attempts to do things through pamphlets, websites, ever glossier, ever bigger exhibitions and so forth. Politicians are often very fond of these things. Exhibitions, cut red tape, announce things, are actually of limited effectiveness. So we have a very big exhibition in the UK on healthcare innovation. It gets fantastic satisfaction rates. But if you look at what do people actually do after they've been to the exhibition, practically nothing. They all have a good time. Oh, that's fantastic. You go home and do nothing. And secondly, in terms of the diffusion of innovation, we often think that it happens through professional networks. We think that it happens through the way in which professionals engage with each other. But actually, by getting a series of studies and insights from other sectors, by understanding the dynamics of what happens in bits of the public sector that have higher rates of diffusion, or in part the third sector and voluntary sector which have higher rates of diffusion, private sectors that have high rates of diffusion. The critical question isn't about the strength of professional networks as such. The vectors or the agents of diffusion aren't just professionals, but users play a fantastically powerful role. It is users and user demand that, in a sense, pulls innovation through public sector systems. So although we have got better at engaging users in some of the design of new services, actually we tend to engage the immediate users in those processes. We tend to just take those people who are the actual immediate people who are working in this local authority or with this youth offending service or with this probation service. What we're poor at doing is engaging with the user networks and user organisations that are out there that actually can act, if you like, as mobilisers or aggregators of demands in such a way as to pull those innovations through the system. Let me give a couple of examples. They come from the UK and they come from work that the Innovation Unit I'm pleased to be a director of is working with UCL Partners, who's a big health provider in the UK, University College London Health Partners. And I'll just take two examples to illustrate what I mean here. One is about it's got an inelegant title, Patient Relationship Management System for kids with diabetes. Actually, it's about giving them control of their care and management of their disease. It's about putting them as the individuals in charge of their health care. It happens to use a variation of customer relationship management software, but actually the technology is a sort of minor part of what is a much bigger cultural change. And similarly, the other one called Mum's Pad or Empower is a similar thing in maternity services, which is about trying to change the relationship between professionals and mothers-to-be, such that the mothers-to-be are in a partnership or in an engagement with the professionals about what maternity services should look like and what their maternity care should be. Okay? Actually, I'll just tell one story because it will illustrate this. I love the guy who runs this project for kids with diabetes. I think he's fantastic, right? So nothing that I say is going to detract from that. It's a fantastic project. It's wonderfully conceived and so on. I remember very early on talking with him and saying, okay, it's fantastic. We're going to get this thing working in some bit of London. Yeah? You're going to have these kids who are going to be much more in control of monitoring their own conditions, determining when they have appointments, working out their own care. It's going to be much more efficient because actually it's a much more efficient use of consultant time and so forth. But I said to him, that'd be fantastic, Peter. So when you've got it right, and he was involving the kids in doing this, the kids themselves. I said, what you get, supposing you get it right in London, or in this bit of London, how are you going to get it to diffuse, to spread, to be adopted in other parts of London, of the UK, and so on? He said, well, what I thought I'd do is, there's a conference once a year of paediatric diabeticians. And I thought I'd give a paper at that conference. And as he said it, you could hear his sort of energy dissipate, sort of, It's not like I had said it. He knew that this was sort of like, 1 or 2 poems. 20 years later, there might be another bit here. So we said, well, what else could we do? Well, so this route, that would be professional networks, yeah? Through professional networks. So we said, okay, what else might there be possible? Actually, there are 3 organisations in the UK that are organisations of children with diabetes or of the parents and carers of children with diabetes. Diabetes UK, which happens to be on this slide. Juvenile Diabetics Research Foundation. And the third one, which I love because it was just sticks in my memory, is an organisation called childrenwithdiabetes.co.uk. It's actually a website. It's a website, it's a social network of kids with diabetes and of mums of those kids. So Peter trolls off with me and various others and starts talking to these organisations. Would you like to get involved in this project we're develop this system? Yeah, I would love to. Fantastic. What do you reckon to how we might spread it, diffuse it, get it adopted elsewhere? And the kids and the mums in children with diabetes sort of looking as though we're mad. Well, if it's as good as we think it's going to be, we'll just hammer on the doors of our GP practices and on the doors of our local hospitals until they adopt this process as well. Which one do we fancy? Do we fancy the going off to the Paediatric Dietitians Conference in Amsterdam once a year? Or do we fancy a group of really motivated, mobilised, connected networks of users and carers, of parents and patients in this case, are going to do this? Indeed, if we look at some of the most radical innovations, actually they often come from and are energised by those user organisations. So not only do we have to connect together the innovators and the potential adopters, but being able to reach out to users, user networks and organisations, not just the individual users of our services in that way, is really important. Okay, connect with user networks and organisations. Third, if I've got this here, it's about practice-based policy making, connect the ministry with the deliverers. This is a real struggle in my view. I've worked in and with government ministries across the world, across different departments and so forth. There's something about the nature of the way in which civil services have grown around the world with our expertise in policy that has often detached us from the real world of the implementers and deliverers of that policy. And therefore policy has not infrequently failed, not because it wasn't great policy in some terms. I used to sit there when I was in the Prime Minister's strategy and thinking, this is great, dream up the most wonderful, believe me, fantastic policy. But could it be implemented? Could it be implemented with different jobs? And therefore, the importance of connecting the policymakers with the deliverers is a really critical part of this process. And people are struggling with this, the ministries and civil services and departments across the world. I particularly like the notion of practice-based policy making. So like reversing some of the things that people talk about, policy-based practice, evidence-based policy. Practice-based policy says, can we get to a place where as people, as in New York, are developing the new models of practice, the new forms of welfare to work, the new forms of dealing with reoffenders, the new forms of dealing with drug abuse, the new forms of health. Can we engage with them in such a way that the policy isn't, as it were, top-down trying to circumscribe or constrain or at its best enable, but is in a sense worked out from what is actually necessary to support what's emerging in those different fields and those different sectors at the time. And I was just struck, I thought, people are always interested in the UK, but the UK Institute for Government, which is a sort of independent think tank, school of government type arrangement, had produced a month ago an open letter to the Cabinet Secretary and the head of the Civil Service about civil service reform over the next period. The civil service in the UK is faced with a pretty heavy set of challenges. It's being cut by somewhere between a third and a half. It's having to deal with cuts of around 20 to 30% in the services that it controls. And it's doing all this in a situation in which the current government wants to decentralise and devolve a lot of the decision-making power. So these are big, big challenges for the civil service. So the Institute of Government wrote this open letter to the head of the civil service and the Cabinet Secretary. And it sums it up rather well, so I thought rather than it would be round, and it's something you can read if you want to, because it's on the web. It says, a radical shift in civil service accountability is necessary. It would force the civil service to develop new skills and expertise. It would need to be underpinned by a shift in culture, looking outwards, engaging with implementers and understanding users, being prepared to learn from successes and failures. No longer can policymakers regard themselves as sitting on top of a delivery chain which they expect to follow instructions and deliver required outcomes. They will be delivering through multiple providers driven by user choice, to act as what we have called, the Institute of Government, a system steward, requiring different skills and behaviours from those that have traditionally been prized in policymakers. So there's some theme in this about the connection, the reaching out to the innovators in an enabling and supporting way and bringing them together. Are reaching out to strengthen and develop user networks and organisations, and are reaching out to deliverers and providers of services that are really critical to systems. I've probably used more of my time. So I'm just going to throw these up and just say a couple of words around each. I mentioned earlier on about the work that was done in the After Light Bulb programme about looking at other sectors and what makes for high-performing innovators. I quite like this, you probably don't, but I quite like this diagram because out of what was extraordinary about looking, we eventually identified 40 organisations that were high-performing and innovative, and about 13 sectors that were done. This was internationally. And actually, the 5 buckets here were what fitted into that as the, if you like, the system conditions that were important to really creating a system that was innovative and had high rates of diffusion around culture and leadership. There had to be support and investment for innovation. There had to be rewards and recognition for people, not just who were the innovators, but the adopters of innovation. There had to be citizen and user engagement. And there's a whole load of stuff about the regulatory and environment that was really critical, all of which I'm happy to talk about, but we said it enough already. So we can come back on that if you want. Last thing I'd say is, if I was pushed and said, where is really struggling to try and do this stuff about the ministry and deliverers engaging in a way to create policy together? The 2 places that I would look at the moment are interested in the Ministry of Education in British Columbia, which is trying to, which I quite like as the the Deputy Minister, which is actually translates in your terms permanent secretary or Director General role, says, remember him standing on a platform and saying, if we're going to transform the education system, we have to transform ourselves and our relationship to the education system. So, Ministry of Education, interesting stuff, worth looking at. And the other place, which in a different way is straining this, is the Government of Western Australia, which is trying to figure out how it changes the relationship between government and the third and community sector, such that it's not government as funder, third sector as deliverer, but a collaborative in both policy making, commissioning and delivery of those services. I'm sure there are other examples around the world, but I always like to keep this. So, I'll stop at that point and then feel free to ask any questions.
Well, thank you very much. So we'll open the floor to some questions after a very stimulating discussion.
I think your example of the health system, I've got a daughter that just had a daughter herself, and when she went to the first appointment with the pediatrician and so on, he said, I bet you're one of those people who looks everything up on the internet and so on, and she was. But I think diffusion of information has exceeded the way in which information goes out and so on. So I guess I would sort of endorse that, but how can that, in other areas, well, I guess it is social networks are making that happen and so on. The policy development with papers and so on process is now almost obsolete. There are only a few geeks that ever bother to read those things anymore.
Yeah, I mean, there are a few governments that are trying to do sort of wiki-type policy development or open source policy development. We'll see how much that... So it's, you know, companies have struggled in this area. I think it will take government some time to work their way through. But I think your point about the availability and accessibility of information and data and experience fundamentally transforms, not just in health, but in virtually every bit of public services. I mean, I do a lot of work in education. The kids learn more as much out of school as they learn in school. They have access to more information and knowledge out of school than they have access to information and knowledge in school. This fundamentally changes the relationship that they have. So as well as that notion of informed users, it just changes the nature of the public services themselves. So I agree, doctors, it's particularly acute in healthcare because docs, paediatricians, gynecologists, whatever, orthopods, all these people are very used to have had a sort of monopoly of knowledge and people coming in a trusting relationship, and now people come armed with, or at least a proportion of people come armed with, and they say, well, why are you prescribing this and suggesting that? I just read this article that says this is the best way to do it. It's a different world for a doctor or a teacher, indeed a judge, all sorts of people's notions are changing.
I was going to ask you your views on performance-based regulatory systems in relation to innovation, because here in New Zealand we had a huge meltdown of performance-based regulation with our building sector. In fact, the cost of that are greater than the cost of the Christchurch earthquakes. Where effectively in 1991 we brought in a performance-based building act. It completely stopped sector productivity growth. It just stalled, and then we had this huge failure rate. Have you heard any insights in that respect?
Yeah, I mean, if I go back, chance to talk about this slide. If we go into this box up here around culture and leadership, I'll say a bit about that and a bit about this in relation to performance-based, or performance measurement and performance management. I and colleagues interviewed some 45, 50 chief executives or senior managers of highly innovative or high-performing organisations, private, public, third sector. And one of the things that was really, really striking from all of them was that these are people who are passionate about goals, aspirations, values. They have big, big ambitions. They are very concerned about outcomes of organisations in relation to performance metrics. That's not, they don't have any, actually. It's an Australian company that comes to it, but one of the company, Fremantle TV, which where you get here. But Fremantle TV, if you ever go to Fremantle TV, a very groovy environment, really creative, very relaxed, you have lots of armchairs, football machines, drinks, coffee machines, etc. All feels very relaxed. But on each sort of doorpost, there's the sort of ratings of their programmes against other programmes from the night before. That's the only performance measure. No, there's nothing else. A few financial ones that sit elsewhere. But there's a sort of sense about what is it that's driving these organisations. Yeah? So outcomes, I think, are really, really important. But there is, in this bucket, considerable evidence that, let me get this right, because that funding systems and performance management systems that reward improvement in performance are more generative of innovation than those that establish thresholds in performance. So if you reward people on absolute levels of performance, or you create thresholds as most regulatory regimes do, we know that these tend to inhibit innovation in those systems. Whereas systems that have introduced funding where the more you improve, the better your financial or market or sectoral position is, seem to be pretty productive innovation. So I think it's a slightly complex question. What I know is, and it depends what people mean by performance in this, is if you want the systems that really inhibit innovation are those that measure inputs excessively or measure processes excessively. In fact, measure inputs at all or processes at all. But these systems, not surprisingly, inhibit innovation rather than productive or generative innovation.
Of course, we've gone back to a completely prescriptive regulatory regime there, which now our productivity commission says is making housing unaffordable.
Right. I don't know enough to comment. He says carefully. Regulatory regimes, there's two. Regulatory regimes are really important in maintaining thresholds, right? The sort of licensing and all those things, you don't want to have provision and so on. The trick, and it's a complex and difficult area, is how regulatory regimes also incentivize real innovation and real improvement. Because if you set something that has a very tight bar, then people who just flip over the bar will say, phew. And actually the risks of innovating and dropping below the bar are greater than any of the potential benefits. So getting regulatory regimes that both hold the threshold in place and enable that incentive improvement is there. And I do just want to say one thing, because it was something that Veronica said to me just before the beginning, which was, I think for ministries that are charged with innovation across the piece, one of the most important things they can do is to try and work with other ministries on actually what are common problems. One of the difficulties is that health thinks it's all its own problems, or education thinks it's all its own. Actually, these are the regulatory issues, the issues about funding regimes, the issues about accountability regimes are common issues that we can make progress by figuring out together better than we can by trying to figure them out separately.
Just picking up your point about the rewards and incentives, and also the point you're making about the power of the consumers and the demand side. I mean, the thing that strikes me is the incentives in the public sector are quite different from the private sector. So the private sector, the demand side is, the risk taking is likely much higher. I mean, how do you see that? How do you see that being addressed in the public sector?
Two things I do think. I mean, it goes under the sort of, I guess the jargon for this is around choice and voice, really. It's just, for one, preface it with one remark, which is, actually, if I look back over the last 10 years in public sector innovation, my biggest criticism would be that it's been supply side dominated. It hasn't thought about the demand side in any effective way. this, and we've got something to learn, therefore, from the journey that we all travelled in terms of innovation policy on the private sector that started very supply side in the sort of 60s, 70s, and 80s, and has moved more towards demand side policy. Why do I think this is? How do I think this gets expressed in the public sector? Well, I think it does get expressed through voice. That is actually the one that I like most, because it's the most profound in some ways, is that the treatment and care of people living with HIV/AIDS was transformed by the activities of those people and those communities, not by, in alliance with professions, so it was about their demand. Personalised, individualised budgets, what we call self-directed services. Is that the term you use? Can't remember what term it is. Sorry? No, it's more than that. People with individual budgets, do you have something about self-directed services? No? Okay. It came out of the disability rights movement. It didn't come out of sort of the public sector itself. So there is a sort of expressible demand that comes from that, if we're willing to listen to it and open it up. And the second is, I happen to be a fan, it's often more contentious for some reason, but I'm a big believer in user choice. So I'm a big believer in getting diversity of provision from different sorts of providers and having user choice driving this. To enable that to happen requires you to have accessible, granular comparative performance information, but even small amounts of users switching from one public service provider to another has real effects on dragging provision to a higher plane and inducing innovation. So I think if you're asking how do you get expressed demands in the public sector, you do it by introducing user choice. That doesn't necessarily have to involve private provision at all. It can be done entirely through public provision. You can have systems which hospitals are competing for patients or schools competing. You can have chains, federations, trusts of schools. You can do all sorts of things that are possible to create the environment in which user choice is there, but you know that user choice is pretty powerful. That level of competition is pretty powerful in driving innovation.
I suppose I was thinking more about your point about diffusion and the incentives operating in the public sector in silos. I was thinking.
Oh, I agree with that. At the moment, as it is, that's true. But if you allowed people, I should have said, one of the other models that we have in the public sector, sorry, one of the other underlying assumptions about diffusion in the public sector is our inherited model is about the innovation transferring from organisation A to organisation B. That's the model that we sort of operate with. But actually, if you look at dynamic third sectors, dynamic bits of public sectors, dynamic private sectors, actually the dominant mechanism by which particularly radical innovation spread is not through transfer from organisation A to organisation B, but by organisation A growing its share of the sector, its share of the market or whatever, and displacing organisation B. And you see this effect, you're seeing it in many countries around the world, in education and in healthcare, of gradual aggregation. It's not about bigger and bigger schools, but of schools chaining together and displacing underperforming or less innovative schools. You see the beginnings of this in healthcare in different parts of the world. So I think that notion of displacement, of scale and displacement, is a really important way in which diffusion takes place.
So I just want to pick up on what you were just talking about. Also, in your presentation, you talked a lot about connectedness and collaboration. And when you talk about choice and competition, obviously some of the incentives are you've got competing providers. How do you set up the incentives correctly so that competing providers still want to be part of the iZone or whatever it is, to actually make sure that the innovation doesn't just stay in one academy network or whatever, and actually goes to the other ones as well? How do you balance those two kind of collaboration with competition?
Okay. Just conscious of time. How long have we got? We're okay? Okay. This is slightly technical. Okay, so if you take a perfect competition market, a market of small, relatively equal size competing units, a sort of street market model of what a perfect market looks like. Yeah. So that sort of competition, which is sort of what we have in, say, the education system, where you have choice, or in healthcare where you have choice. Actually, these systems are very, very unproductive of the diffusion of innovation. So it's not about markets per se. It is about a combination of scale and market that's important. So this bit here, which is about the supply side, if you look at high-performing innovative sectors, they all have a very, very similar structure. And that structure is they have a core, a sort of oligopolized core of 4 or 5 or 6 big providers who are taking anything between, I don't know, 50, 60, 70% of the sector. And a periphery, a wide periphery of startups, specialist providers, niche suppliers, etc., etc. So if you've got in your head a sort of donut, you've got a core of these sort of big providers, and then this ring around it. And in fact, how does diffusion of innovation take place? Actually, these big organisations in the middle in general aren't very innovative. It's always where I get in trouble with some things, but they're not very innovative themselves, but they're very acquisitive. So if you take someone like Microsoft, and you invent a piece of really neat software in your back garden, along comes some nice person from Microsoft, makes you very rich, but what they do is they put that piece of software on, as it were, 90 million platforms around the world simultaneously. These big providers in the middle are the engines of diffusion, of the transmission to scale, of the standardization, but they're not of themselves often very innovative. It's coming from that core, from that periphery, yeah? And the other dynamics is the boundaries of both of those are very fluid. So we know that highly innovative systems with high rates of diffusion have lots of entry and exit around the edge. Lots of entry and exit around the edge. And they also have lots of activity going on between the core and the periphery, merger and acquisition, demerger, spinning off, and so on. These are common features of these. Indeed, in parts of the public sector as well, you can see this. So you're right, the incentives question is a tricky question, because it's not about legislating for that structure, but you have to, in regulate it. I think we're often, I don't know the situation enough in New Zealand, so I'd be really interested to hear, but in my view, there's too much talk about markets or not markets in public services, where actually the real issue is about the nature of the market, not markets or not markets. And therefore the incentive system is really critical. So in terms of regulation, you know, the set of questions I always ask in these situations is, does your regulatory system enable the entry of new providers? Does it enable the exiting of providers who aren't performing? Does it enable merger and acquisition? Does it reward people going to scale where appropriate? All these are really important questions and end up as balances that you have to make in judgment of this. And where I think the real challenge for regulators and for ministries is around market regulation. I think has been an area that we I'll speak for the UK, then you can say it's differently, where I think we have been naive and unsophisticated in our approach, including naive and unsophisticated in our approaches, and only gradually learning about what it is that really is required to be sensitive regulators of markets. I don't mean, and that's why this stuff which is about light touch or heavy touch is a wrong question again. It's about the nature of regulation, the nature of what you're trying to do in the markets is really important.
Thank you very much, David. Clearly you've stimulated a lot of discussion, and for me particularly the idea of after the light bulb is really important, because that's how you get the value out of ideas and through innovation. So you've provided us with a great deal of food for thought. And I'd just like everybody here, to invite everybody here first to join me in thanking you, but afterwards we have some tea and biscuits where I'm sure we can ask some further questions of you in the kitchen. So please join me in thanking David very much.